On this story, we are now joined in studio by Dr. Marlin Mckay, a specialist in HIV/AIDS, obesity, health and wellness. Thank you very much for joining us, Doctor.
Thank you.
Now, let's look at the significance of the International HIV/AIDS Conference. Take us through that.
Okay, so this particular conference is held every second year, and as you can see from those numbers, it's huge. Almost 20,000 delegates descending upon Durban from so many countries. And it's really a milestone, especially to have it in Durban again after the last one. The last one was held in 2000, that's 16 years ago. It's only the second time it's been held in sub-Saharan Africa again. And so I think it's very significant in that we're returning there, because when we started, that is when we were just starting with antiretroviral therapy. And as you can see again, we've come such a long way. South Africa is at the forefront in terms of our ARV program, the largest in the world, despite having the largest amount of people living with HIV. And we've made tremendous strides to get to where we are now, with so many people on ARVs, and our patients are doing well. There's still a long way to go, and that is why this conference is so important in terms of where we are now and where we still need to be in terms of getting to our goal, so that one day we can hopefully eradicate HIV.
Now, you've just mentioned that we will be looking at the past and how far we've come in terms of eradicating HIV. But what specific issues are you expecting to take priority at this year's conference?
Okay. So I think we've passed the fact that now people need to know their status. Once they know their status, they need to, and if they are positive, to get onto ARV therapy. The studies have shown that unequivocally, and we're absolutely clear on that. Now we need to keep our patients well and healthy. ARVs do that. We need to focus on preventing new infections. And some of the focus population groups are especially our adolescent girls and young women. The latest data showing probably about 1,000 new infections among them alone. So even though we're doing well overall, there are still certain places where there's tremendous room for improvement. And I think that's where we're going to be focusing on. And then also this new concept of pre-exposure prophylaxis, where we are able to protect someone who is negative but in a high-risk situation from them becoming HIV positive. And so by doing that, we are really enlarging our armamentarium so that fewer people become infected. Those who are infected can stay on treatment and be healthy, and that will go a long way to getting to where we want to be.
I want to go back to what you just mentioned now about young women and the high infection rate there specifically. What are we doing wrong, and what should we be doing to ensure that this, those numbers drop?
Yeah.
Because they are extremely high.
Yes, so we know historically that women have always borne the brunt of the HIV pandemic. Most of the infections are in women, and I think taking it a step back, it starts with everyone knowing their status, and it starts with men knowing their status, because the value of ARV programs come in by people knowing their status and then getting onto treatment and remaining on treatment. So if you look at the numbers, we need more patients to come forward to know their status. Those need to then get access into the program, and then to stay on treatment so that they can become what we call virally suppressed, so that they're no longer able to pass on that infection. And so by focusing and targeting adolescent girls and women and assisting them, especially with PrEP, so that they have a weapon to prevent them becoming infected, I think we'll manage that quite well.
I think education is always, has a big role here. From the time kids are in primary school, we started learning about HIV and AIDS from primary school already, if I can remember clearly. Is that working? What should we be doing in terms of bringing the education there? Because one would say people know about it already, but why are we still getting these high levels of infections every day? Yeah,
so I think we've also gone through a phase where there's been apathy toward education and a bit of AIDS fatigue. But I think we on a level right now where we are excited again and passionate again. The issue for me with education, many of us know, our young people know about HIV. But we need that education to translate into a behavior change. For instance, everyone knows that one of the best weapons to prevent HIV is the use of condoms. The question is, do they actually use a condom every single time that they have sexual intercourse? So is that education and the knowledge actually translating into the way they behave? And many of the kids will answer, or the young people say, no, they don't. So it's not translating into effective condom use or whatever the situation is. So somehow there is a gap between what we know versus how it translates into how we actually behave so that we can reduce the infection.
And also, speaking of a gap, I mean, when you say young people, that's also another debate. What age is the right age to start talking about it, for example?
Yeah. So I believe that as soon as a kid is able to ask questions, then they are ready to know, number one. Number two, sexual education on every level must start very, very early. For instance, even the way we teach our kids the organs of the body, we tend to have these nicknames for things. I believe that they need to know the
real name of an organ
from day one. So they must be able to use and talk that language. And so from an early age, even though you may not be using words like sexual intercourse, for instance, but you are educating them about the body, about the harms, about illnesses, as soon as they can literally start talking.
Now, earlier on this year, the health minister announced the CD4 Count Eligibility criteria, saying that it's going to be removed as from September. Is that a step in the right direction? What's your take on that?
Oh, absolutely. We've been waiting for this. You know, the problem is we've never known what is the best time to start. And so we started from as low as 200, and then we moved up to 350, and then it became 500. And then last year, July, we were in Vancouver in Canada, and the results of the START trial came through, Temprano study. And finally, we had unequivocal data that showed the tremendous benefit of testing and treating, which means that as soon as one knows your status, you are eligible you should be eligible, and you should be pushed to start on antiretroviral treatment because of the reduction in both HIV complications and non-AIDS complications. In other words, diseases unrelated to HIV, you still see a reduction in them by starting early. So for me, it's the best news ever in terms of management of HIV.
I want us to go back to more of the socio-economic issues around the spread of HIV and AIDS. Let's look at sexual and gender-based violence specifically. How does that impact on the spread of the virus?
Okay, so that plays a tremendous role, and especially in the context of South Africa. And this is where things like PrEP play such an important role, because someone who may be exposed to that or may be vulnerable to that sort of thing has now access to a drug which, by virtue of taking that, can actually prevent transmission of HIV. So you're not playing catch up where one needs to use something like post-exposure measures, but anticipating that you have a weapon by taking a pill once a day called PrEP, can then prevent that or lower that risk. And again, all the other issues around safety, around basic protection and basic prevention strategies still need to be enforced if you're going to make a difference in that. So I think we're getting somewhere, still very slow, but there's lots of improvement that we can focus on.
How long is it going to take?
Yeah, so that's not an easy answer question, you know. But I think every day counts, and every conference, and this is why these conferences are so important, because we are making strides in the right direction. But we are very, very hopeful, and that's why we have things like End AIDS by 2030, the UN AIDS 90-90-90 challenge. So everywhere, fighting towards an AIDS cure is another conference that takes place, even at our conference now. So there are all these conferences and all these challenges that are out there so that we can get this job done soon, and I think we're going to get there.
Now, something that I always think about, especially when conferences come up, and you've just mentioned now the UN 2030 and the 90-90-90, for examples, is when do we move beyond talk shops? Are we seeing action?
Yeah, no, absolutely. And this is why there's so much feedback. So for instance, this conference, it's held every second year. The last one was in Melbourne. So there's follow-up from that. There's report backs.
What did we do then?
What did we ask for? What did we expect then? Have we met those expectations? Have we met those challenges? How far? How are we doing? And even today, there's reports coming back. Guys, we are missing the boat here. These are still the gaps that we need to do. So conference is a good way of evaluating, monitoring, and then maybe resetting the bar, resetting some new goals to make it more accessible and reachable in terms of ending HIV.
Now let's look at the messaging that has evolved around HIV and AIDS. There was ABC, which is abstain, be faithful, condomize. Where are we taking it now, and where should we be taking it?
Okay. So I think some the principles still apply. But some of the new messages that are coming now is as always, know your status. Number 2, test and treat. Right? In other words, as soon as you know your status, if you are positive, get onto treatment. And if you are in a high-risk relationship or situation where you need protection, there is PrEP available. And underlying all that, those strategies still exist, the A, B, C, D, whatever the case is. But we are looking now towards actual adding value and adding meat to those, because now we have the drugs available to even prevent that further.
I think for somebody who doesn't understand how the PrEP works, so you're saying if you're in a high-risk situation or high-risk relationship, you can take the PrEP. So do you take it continuously to protect yourself from acquiring or you know, being infected with HIV, and what are the side effects thereof?
Okay.
I mean, and also doesn't it create the situation where people are just reckless then?
Yes. So it's a very strong process that we and education that's based on this. So the scenario is really when someone is in what we call a serodiscordant relationship. So one partner is positive and the other is negative. So for instance, if perhaps they want to have a baby, and the one does not want to become infected, and they also want an HIV negative baby. So for the duration of that time where they would have unprotected sex in order to fall pregnant, the uninfected partner would then take this medication with PrEP in order to do that. And yes, with every medication there are side effects, and so we would counsel the person through that. We would counsel them through the risks and how to protect that. It is not 100% as with anything, not 100% guaranteed. So using those different scenarios, commercial sex workers is the other avenue where we are using this drug, so that the women can then protect themselves through that. In men who have sex with men, high risk situation, there can also be given medication like that. So there's a lot of counseling involved. It's not just the willy-nilly handing out a pill, here, off you go. There's pre-testing, pre-counseling, and regular follow-up HIV testing, and the side effects, checking out the kidneys and making sure that they're coping well with the medication as well.
Now, Doctor, you're the co-founder of the Lighthouse AIDS Poverty Center. Briefly take us through what that entails exactly.
Okay, so how it actually started, at one stage I was looking after an AIDS hospice. And then as ARVs became available in South Africa at that time, we realized that our patients with HIV, once they come and go onto treatment, they will die with HIV, they will not die from it. So I didn't see the need to be involved in a hospice. And I wanted a place where families could come and find a home. And the word that the other name for it is called lapeng. So they could come in and have access to free counseling and testing, and that acts as a gateway for them to get access to treatment, care and support. And this initiative was started where we opened our doors in a community, impoverished community, and people could just walk in off the street. Doctor, I'm here, I would like an HIV test. I would counsel them, and soon we had 30, 40 and now over 100 families that I look after. Just in terms of taking care of them, supporting them, getting them access to treatment, and looking after their basic social needs so that they can cope well with their disease.
Now, in terms of other organizations that you're working with, what kind of support is your organization, for example, getting? What kind of support, are you still in need of, for example?
So unfortunately, I don't have that much support. I have a few private patients and business people who would help me on a personal level. So I would just approach them and say, these are my projects, these are my needs, would you help me with this? My practice also lends a major financial assistance to this. So I'm able to do that, volunteer my time, my practice money, and rely on a few individuals who are very, very kind in terms of. So we put some young people through university at present, kids through school, send them on tours, and all sorts of community initiatives that we assist with.
Doctor, just before we wrap up, I guess a good question would be, what needs to be done next? What needs to be done today, tomorrow, right now in the short term to ensure that we reach the goals, that were set 2 years ago, that are also going to be set this year at the 21st AIDS Conference?
For me, just on a local level, South African level, we have 6-7 million people living with HIV. That means we need to have 7 million people on antiretrovirals. We only have just over 3 million.
Can we afford it?
I think we can. We must find the money, number one. There are organizations like PEPFAR who are there. But I think the financial benefit or the country benefit overwhelms anything else. And so if you focus on getting everyone who is positive onto treatment, we are going to win the battle. So it starts with closing that gap between those who are infected and on treatment versus covering everybody in the country who is positive.
Doctor, thank you so much for joining us. You're doing some amazing work.
Thank you very much.
That was Dr. Marlin Mckay, a specialist in HIV/AIDS, obesity, health and wellness, talking to us about the 21st AIDS conference. We'll have more news for you.